Welcome you back, and in mere moments you will, I guess we could label this just the facts from Newsmax and informed opinion, because from Newsmax.com, our parent website, we've got senior editor David Patten and the deputy health editor Nick Tate. Gentlemen, as always, we appreciate the fact that you devote considerable verbiage to the website and context, and in the same way, we have you here on Newsmax TV to talk about just what we heard from John Graham, the 8 myths of Obamacare. Now, Nick, you've written quite a bit about Obamacare. When it comes to what John Graham has to say about 8 genuine myths to Obamacare, is he accurate?
I think we're right on target there. I mean, the truth is that for a long time we've been predicting that many of the things that the president promised in 2009 were really not going to be true. And what we're finding now is the reality is that the rhetoric does not match what we're seeing, and we can now measure it. So it's no longer predictive. We know that costs are going up. We know that people's choices are being narrowed. And we know that some of the promises that the president made have just not been true. So I think that John Graham's right on target with much of this.
Now, Dave Patten, since that day when then Senator John Warner, when you were a high school reporter, had you into his office and impressed you with...
that wasn't that long ago, by the way.
That was just a couple of weeks ago, metaphorically speaking,
not
too long ago. But in your considerable experience, this gulf between the rhetoric of the president's policies and reality, is this the biggest... I want to say snow job, but I'll say sales job in history with a defective product?
Well, you always wonder, is it just this president, or how does it fit into, the greater context of what presidents have to do, which a lot of times is promise high and deliver low. It seems in this specific case, the president came out and grossly oversold what this is going to do. We know there's still going to be a lot of people who aren't going to be insured, for example. We know that the cost spiral has not been stopped. Costs continue to go up. So we're really just beginning to get into the economic repercussions. For example, there was a recent survey done that showed that 33% of respondents think that they may have to delay their retirement due to higher healthcare premiums and costs associated with Obamacare. So it's a big impact.
You know, gents, when I first ran for Congress, my constituents would lament the fact that, gee, the government tends to step into everything. And I had one gentleman very active in civic clubs saying, we used to be in the charity business, but now the government has taken that over. However, when it comes to Obamacare, there's a curious situation in terms of tightening the requirements. And one hospital executive had this to say, quoting now Nancy Schickling, the chief executive of the Henry Ford Health System in Detroit, "Do we allow our charity care programs to kick in if people are unwilling to sign up? Our inclination is to say we will not, because it just seems to defeat the purpose of what the Affordable Care Act has put in place." So, Nick, again, an example of the government stepping into what used to be the rightful realm of charity?
Well, I think that's definitely happened. And the question is, how is it going to actually compromise the care that's provided, not just by charity hospitals and facilities, but by all hospital facilities? There's going to be a huge increase in the number of people who have insurance who are coming into the system, somewhere between 25 and 30 million people. And as we've seen with what's happened with the VA scandal, when you have more patients than doctors can treat, there are necessarily going to be problems. And that's my concern, not just on the charity front lines, but also on hospital front lines. David, to your point, what I can't help but wonder at this point is, where would we be today if the president and the advocates of Obamacare and healthcare reform had said in 2009, look, you can't make big changes without some pain. We're going to pay more. There are going to be some disruptive changes. It's going to be more complicated for people, but we're going to tell you the truth about what's coming your way. I wonder if people would be a little more open to what's happening, number one. But number two, to your point, would he have been able to sell it had he told the truth?
Well, when you look at the opinion polls and you ask the American people, you get somewhere between 51 to 55% who don't like Obamacare. They think it's a bad bill. So that would imply that had the facts been put on the table, the answer would be no, could have even complicated the 2012 election.
Well, I just think back to the political side of this. You'll recall how the atmospherics were. It was around Christmas time. And the alphabet networks had their reporters out with their long faces. President Obama and his family have delayed their Hawaiian Christmas vacation so that the president can keep an eye on the Senate. I long lamented that all these conservatives who were there, all they had to do was employ regular order, have the clerk read the 3,000 plus pages. They would have stayed through Christmas. The American people would have been educated, and maybe this would not have been foisted upon it. But to your point about the merging of politics, policy, reality, and support, you take a look at the waivers that have been issued. I mean, you can argue the administration is kind of like a baseball executive, putting all these different groups on the waiver wire, including waivers for labor unions. Now, David, labor unions, the bread and butter, the life's blood of the Democratic Party and one of its reliable constituencies, with labor unions seeing increase in health care costs, does this mean a realignment politically?
Well, probably not. Some of the unions still seem to be supporting it. Others are really not happy at all. They're particularly not happy, which is with what's happened to some of the upper end plans that are affected under Obamacare. If you want to know where we're headed on this and talk about waivers, it was really interesting that on Friday, the government came out and said that they would fund this risk corridor program. That's the so-called slush funds that helps the insurance companies if their costs tend to be much higher. They've now decided premiums won't go up too high. Why? Because they know that'll hammer Democrats at the ballot box. So we're seeing waivers continue to occur even as we speak.
So the waivers, rewriting the rules, executive fiat, not waiting on Congress. Nick, you take a look at this, and the president is insistent this program will stay in place, and now some Republicans seem to be kind of mealy-mouthing this thing, almost channeling Bill Clinton. Oh, mend it, don't end it. Where I'm sitting with my past experience, I say, you got to abolish this thing. Is that realistic?
We've gone so down the road on this that I think it's going to be hard to pull back some of the aspects of the plan that have already taken effect. And what we're seeing in both Republican quarters as well as with some Democrats is the idea that some aspects of this plan actually want to keep in place. Maybe we fund them in a different way, making sure people can get insurance if they have a pre-existing condition, letting dependents stay on their parents' health insurance till age 26, some of the Medicare benefits, although costly, that have gone to seniors. What's interesting to me, though, is that what we're now seeing is that some of the Democrats are starting to step up, and left-leaning organizations are saying, let's make some changes. Just this week, the Urban Institute, which is a left-leaning think tank that I think a lot of liberal folks take very seriously, is recommending and suggesting that the administration just do away with the employer mandate, which kicks in over the next 2 years and requires companies with 50 or more employees to provide health insurance, saying it's not going to expand the number of people with insurance. In fact, it may drive many companies, as Morgan has suggested earlier, to drop health insurance. Now, when you have an organization like that I think is as well regarded as they are in left-leaning quarters, making that recommendation, Democrats in the White House, it seems to me, have to take that seriously.
Now, that is interesting. Is that just an outlier from the Urban Institute? Because, David, the scenario I always thought of was they wanted to see these problems to drive us into a single-payer Canadian plan. So could it be the left is saying, wait a minute, this doesn't work politically, our ideology notwithstanding?
Or wait a minute, we have an election coming up, so we want to go. We want to go single payer, but we don't want to go single payer quite yet.
Oh, I used to remember something about elections. It used to be a biennial thing for me.
You know how it goes. And to Nick's point, while we said earlier 55% or thereabouts of people are against Obamacare, when you then ask them, well, what do you want to do? Do you want to throw it out? About 6 in 10 say, no, we don't. There are some things in there we want to keep. They like the being able to keep your children on your policy through 26, the fact that you can't be denied coverage due to pre-existing conditions. So the likelihood appears politically, at least under this president, while Obama is in office, that some of these things will stick around, no matter how unpopular the rest of it may be.
Nick, maybe it's unfair. There's only a minute. This will ask for introspection, but your thorough analysis of Obamacare will let you do this. The biggest surprise thus far?
I think the amount of money that it's costing. I knew it was going to be expensive, but I think the costs are much higher for most people than we anticipated. That's the biggest surprise to me. If I can quickly say, while 2012 was also a referendum on Obamacare, I think 2014 will be, and 2016 will be as well. Only now we see how it's affecting people, and that's what's going to drive, not hopes, not wishes, not dreams, and not promises.
No, I agree, and also some of these premium increases are going to be notices sent to consumers around September, October this year.
That's right.
Right before they go to vote.
You're right.
Oh, there you have it, right before the vote. David Patten, Nick Tate, we thank you. Your personal prescriptions for Obamacare, very important. Hey, listen, what do you think is going to happen with O-Care? We'd love to hear from you. Why don't you tweet me your comments at Newsmax TV, #America's Forum. We'll be right back.